Welcome everyone to this webinar on mental health framework, which was published in December and it's available as a free PDF document from the Energy Institute's publications website. So next slide, please. So my name is Laszlo Kumari. I'm technical manager for the energy transition theme within health and safety at the Energy Institute's Technical and Innovation Department. I'll be moderating this session today and will shortly be joined by Mandy Rutter, author of the Mental Health Framework, who will talk about the framework and how it can help organizations improve their mental health programs. And that will be followed by a 15-minute Q&A session. Next slide, yes. So just a few notes on housekeeping before we get started. So this webinar is being recorded and the recording will be available after the event. All participants will be muted except for the presenters. Please use the Q&A function for posting questions rather than the chat function, as it can get a bit confusing. Next slide, please. So before I hand it over to Mandy, I would like to give you a brief introduction of the Energy Institute and the Technical and Innovation Program. So the EI is a chartered professional membership body for people who work across the world of energy. It's a registered charity with the Royal Charter and a long history dating back to 1914. It offers expert-led training courses, accreditation, and professional development opportunities, including pathways to chartered engineer, chartered environmentalist, and energy manager statuses. The EI has 20,000 individual members, 200 partner companies in 120 countries, with the main purpose of creating a better energy future for its members and society by accelerating the global energy transition to net zero. Next slide, please. So how do we do this? We do this through attracting, developing, and equipping a diverse future energy force through, for example, professional membership and training courses. And we also do this by informing energy decision-making through convening expertise and advice, for instance, through our flagship event, the International Energy Week. And we also have an annual report called the Statistical Review of World Energy, which provides an overview of the global energy markets for the previous year. And so we also do this by enabling industry and customers to make energy lower carbon, safe, and more efficient through technical work, company membership, and so on. So our technical and innovation program plays an important role in driving these three objectives, and in particular when it comes to making energy lower carbon, safer, and more efficient. So the program has an annual budget of about £2.5 million and is secured through our technical partners. This budget is then put towards developing good practice resources, such as guidelines, research reports, and even animations. And these help make workplaces and operations safer and more efficient. So we are proud to have 58 technical partners on board, with more joining us each year. They range from major global energy companies, but also engineering firms, equipment manufacturers, and they're all dedicated to make positive change. Next slide, please. So this industry-driven approach enables us to be what we call the independent custodian of the technical and innovation expertise for the global energy sector. So we develop over 30 new technical resources each year through collaboration with external stakeholders, including trade associations, non-governmental organizations, regulators, and the academia. So our resources cover a wide range of topics across the energy transition, fuels and fuels handling, health, safety, and the environment themes. And the mental health framework, which is what we are going to talk about today, is a unique resource in a way that it's the only EI technical publication that is equally relevant across all these areas, and in fact across all industries. But I'll let Mandy talk about that. So Mandy will introduce herself, give us an overview of the framework and how it can be integrated into your organization. So Mandy, over to you, please.
Fantastic. Really great to be here. I'm Mandy Rutter. I've been a psychologist for a long time, and my work has been in organisations with a real mission to help people within organisations feel that their work contributes positively to their mental health. We spend so much time at work, and it's really essential that our work not just sort of fulfills our sort of intellectual ambition and our financial ambition, but helps to fulfill both our development, our ambitions, our personalities. 40% of us nearly meet our partners at work, and some of us meet multiple partners at work. Our relationships at work are absolutely crucial to help us feel good about ourselves, about our work, about all of the things that in the workplace that help to contribute to good mental health. I've spent quite a bit of time working in trauma support, helping people recover after accidents and injuries. And I've also done a lot of education and training to help managers and leaders really take this subject as serious as we need to. So today we're going to talk about our mental health framework, and the framework is like a sort of skeleton. It's like a fabric, a piece of a sort of sculpture that really holds the flesh of your organization's mental health approach and policies. So what we're describing to you is a structure for which you can then flesh it out. So this is like a skeleton, and in a way, all of your particular organization's like content is like the muscles and the veins that run through the skeleton. But the skeleton is what we're going to be talking about today. So let's have a look. Why have we done this? And as Laszlo said, in a way, the mental health framework really transcends across all industries and across all people. All of us have a mental health. Some of us have good mental health, some of us have not so good mental health, but mental health is universal. It makes us who we are. It's the spirit of who we are. And why is this important now? Because this has in a way always been the case. We've always had mental health. Why is it important now? Well, you can, in a way, decide for yourself which of these reasons is relevant to you personally and your organization. You know, we can have reasons, personal reasons, that the way we feel, the way we think has a profound effect on our daily functioning. Our ability to think, our ability to make decisions, our ability to feel confident and take care of ourselves is all about the health of our emotions and our mental health. But social. So actually why this is important now is because we live in our society today, certainly, where we have more loneliness than we've ever had. Our loneliness actually could be seen as the next epidemic, really, that started actually when mobile phones came in back in 2007 and we had 24-hour internet. That's when the loneliness really started to take hold, and the pandemic increased that. But loneliness and isolation has an incredible impact on our functioning, you know, both physically and psychologically. And workplaces can have a really positive impact on helping to overcome loneliness, creating social bonds, creating networks, helping to create local communities that help us to manage that loneliness. Workplaces, as we've said, you know, our relationship with our line manager often has more influence on our mental health than our GP, in some cases our family. You know, that relationship, that one-to-one relationship that you have with your line manager has a huge impact on how we feel, our confidence, our beliefs. And therefore, it's imperative that our line managers and our leaders understand the impact they have on people's mental health. And then if you are concerned about statistics and finances, which of course we all are, that one of the things is that depression, which is one of our, the common mental health disorders along with anxiety, but depression will be the biggest global burden of disease by 2030, according to the World Health Organization. So at the moment it's cardiovascular illness, but it's going to be depression. So our mental health is going to be the cause of the biggest burden of disease. And we have an increased amount of absenteeism and presenteeism and employee turnover because of poor mental health. And again, the pandemic didn't make that better, it really made that worse. And we have not recovered suitably since the pandemic. So fundamentally, there is one of the things about the mental health framework and why this is important, you have to select which reason is relevant for your organization when you think about this, because the impact is enormous. And so what I'm going to talk about, when we talk about our skeleton, I'm going to talk about the 4 sort of foundations and the 4 pillars of our skeleton. And these 4 pillars are understanding what mental health is about, what our existing pattern looks like in our organizations, defining for you what a mental health framework looks like, what mental health support looks like in your organization, whether it's education, whether it's counseling support, whether it's mental health first aiders, deploying that, putting that into action, and then embedding it and sustaining it. There's no point having a big drive for a year and then letting it drop. So that's how we're going to focus. So let's start with understanding. And I'd just like to be thoughtful for a second and ask you, all of the people who are on our call today, to just think for a second about your continuum of mental health, how you are each day. Does how your mental health, does it shift and change around? Do we, in a way, start out by flourishing each morning and interested, energetic, optimistic? As the day goes on, do we move down into just about managing, eating and sleeping well and socializing, but maybe being a little bit preoccupied, to just about coping? By the time it gets to lunchtime or afternoon, are we just about coping and glad that we're getting through? And then maybe if we get exhausted and tired and fed up, struggling, to absolutely needing some sort of help now. And I guess we can do this each day. We can move in terms of our continuum. Our mental health moves up and down. It's healthy for our mental health to be up and down, up sometimes and excited and interested and flourishing, and sometimes maybe not so much, maybe feeling tired and exhausted. And then we do some good, healthy habits to help our mental health and we get back up to a good place. So our mental health is sort of rhythmical as we move through the days, the weeks, the months, the years. So many people I talk to feel that actually during the winter months, they probably sometimes don't get much higher than coping, just glad to get through, going through the motions, feeling a little, sad seasonal affective disorder. The dark lights impacts their release of endorphins and their release of serotonin. But now we're in the light, those of us here in the UK, we're in the lighter months, and then people are feeling they're a little bit more positive and calm and eating was socializing, more opportunity to chat to people on the streets, outside. But actually, how many of us are flourishing? How many of us spend most of our time flourishing? And when I ask people in workplaces, how many percentage of people think that they're flourishing? Sometimes I'll just get 1 or 2%. We want all of our mental health. We want our mental health to be at times touch on things which are excited, self-motivated, curious, ambitious. We want to move towards the blue end here of our continuum. That surely is what our aim is. But we also want to understand what we can do when we're just at managing or coping to help to make it shift a little bit more towards the blue, but also help ourselves when we're more struggling. How can we support ourselves and each other And what resources do you have for people who need help now in burnout, anxiety, feeling like there's no point? And whilst, you know, in relation to our mental health, I'm going to talk today about a pretty sort of, as I said, the foundations and the pillars, like the skeleton of the framework. But for any of you who are listening today who've come on our call wanting to get help, either for yourselves or for others, please stay with us, because we have some links to the framework, and in the framework we've got lots of resources. Don't come onto this call feeling anxious and stressed and go off the call still feeling the same and doing nothing about it. Please take action after we've done this call to help to move yourself out of that red and a little bit further up into the blue. Okay, so let's do a little audit. We're talking about mental health. Well, how do we keep ourselves in good mental health? And so today, there's lots of ways you can keep doing that. And there's lots of healthy habits and lists of healthy habits. I'd just like us to do a little audit for the people on our call today. And please don't feel overwhelmed by this. But in terms of keeping our mental health in good shape, so keeping us alert, keeping us confident, keeping us feeling good about ourselves, keeping us motivated, keeping us well, we need to do some healthy habits on a daily basis. And today I would like to sort of like just bring you this list of trying to understand about healthy habits in relation to 4 energy dimensions of the body. Physical in the green, emotional, so keeping our emotions healthy in the blue, keeping our brain, our frontal cortex, keeping our cognitions healthy in the orange, and then our spirit, the values in the purple. So don't feel overwhelmed by this. I'm not asking you to get 19 out of 19, but I am asking you to have a little look and see if you've got maybe at least 2 healthy habits in each quadrant. Are you managing to sort of like keep that exercise up every day? Are you managing to understand a little about mindfulness? And those of you who are on this call who are a little bit, you know, not convinced by mindfulness and meditation, the research is incredible for how it really helps us to manage our anxiety, helps us to feel more present, helps us to shift ourselves from an anxious place, from that little amygdala, the back of the brain, that sort of primitive part, back into the thoughtful place. So I'd ask you, if you're interested, to have a look at the research, and hopefully that will give you an opportunity to think about trying some mindfulness. Emotions, number 10, surely, laughing every day. Our children laugh every day. Our children laugh, I don't know, 80 to 100 times a day. When was the last time you laughed till the tears roll down your face? There's a lot to be anxious about, but there's also a lot that we can love and be grateful for and laugh with. Look at the orange, that's our frontal cortex. How are we keeping our brain healthy? There's a book recently out called sort of Healthy Habits for Brain Boosting. And, you know, it's everything that we're describing here. It's not magical. There's no secret equation. It's the everyday healthy habits, connecting with others, exercise, hydration, nutrition, having meaning, being interested in others, exploring our communities, everything that is good for us, like helps us to everything that's good for us produces those endorphins, produces serotonin to help us keep our mood stable. And then I guess the last one on the purple there for a second, this is an interesting one. This is about our spirit, and our values are really part of our mental health. And if you're working in a role where you don't feel connected, you don't feel that you belong, you don't feel it's part of what you want to do, you know, it doesn't matter how many steps you take or how much breathing, mindfulness breathing. In a way, we have to be really careful around if our working that we do and the life that we lead doesn't match the values that we have. You need to be really thoughtful about that and think about what changes we can make. Maybe reach out for some support through coaching, mentoring, buddying, counseling, joining groups, all sorts of things to help to lift and help to match personal values with workplace values. Okay, so a little bit about understanding our mental health there. So what about in the framework? What do we say about this? Well, Understanding our mental health is really about understanding the employee perception of mental health support that we have within our organization. If you asked any of the people that work with you, well, what do we get to help our mental health within our own organization? And part of what we ask you to do in the framework is evaluate the mental health maturity of your organization, because it's self-awareness. And in a way, self-awareness is so important on the journey of mental health. And so now I'm asking you to do some organizational awareness. So how do we look at the maturity of our mental health support within the organization? How we can do that is have a look at the existing frameworks and the existing surveys that you already have that will capture an essence of mental health. And I guess I've got a list down the side here. So things like staff engagement surveys. What does it say about how people feel a sense of belonging, a sense that they feel cared for, a sense that they can contribute? What about your EAP data, employee assistance program? Those people who have EAPs, employee assistance programs, for those people who are not aware of that, we have lots of really brilliant organizations, some large, some small, that provide often a helpline, short-term counseling. Sometimes they provide an app, sometimes they provide financial information, legal information as a completely independent support for the employees within the organization. And you often have a helpline, you often have an app which you can access direct, and employee assistance programs should provide HR or employee engagement teams with data about how many people use the service, what are they calling for, how are they helped by that. It's anonymized data, it's a confidential service, but there's general themes that you can understand, get to understand what is happening a little within the organization. Those of you who have occupational health departments, what about the data there? You know, as sort of at the bottom, we've got sickness data, absence data. How is that changing? How is that? What about the age what's your age demographic? What's your what support are you that is useful to help people return to work? Management discussions. How much is our mental health discussed in managerial discussions? Is there a framework in your sort of management and leadership pathways for having those discussions? Stress surveys. How many of you do stress surveys? What do they look like? Do they change over time? So you are already capturing quite a bit of information about the mental health of your organization, but it may be sporadic in various different places. So what we wanted to ask you to do, this is a snapshot, this lovely orange table. Don't worry too much that the writing is quite small here, because this is a screenshot of what we've got in the framework to help you look at the maturity matrix for your organization. And actually, so across the top, we've got, is it basic? Have we got emerging? Is it mature? Or actually, are we really there? Are we doing really well? And we've helped you look at it with regards to vision, policies, skills and resources, employee awareness, and insights and measurements. So, you know, in a way, basic would mean that maybe we haven't got a vision as such. We've maybe got some policies that are already in, you know, stress awareness policies or health and safety policies. Maybe we haven't got mental health first aiders or wellbeing champions. Maybe we do a calendar of events, but actually it's not particularly targeted, and we don't do any specific any inclusion for maybe people who have neurodiverse conditions, or for people at different stages in their life cycle of an employee's work. So some of us have basic, some of us sort of have slightly more emerging maturity, where it can actually, we have a vision, we have maybe some strategies, maybe we have some policies around mental health, maybe you have external support already in place, EAPs with growing take-up, maybe you have a calendar of events that's targeted for particular groups, you know, maybe you have some wellbeing champions, and you are able to sort of begin to report back on it. Or as we move up here, we've got mature, much more mature sort of support, where you've got clear visions, we've got detailed policies where you're able to like have a specific pathway, and a wide range of insight that you report on and you can work with there. So what we thought we would do, just to have a little look at this for a second, is have a look at, just for a second, about where you think your organisation may fit. And it may be that it's mixed, but that generally where your organisation fits in the maturity. And just have a little think about that, because on my next slide, I've got a QR code, because we're going to do a poll on where you think your organisation fits in our maturity matrix. So take a second and have a little look at that. And then I'm just going to move our screen on for a minute. Oops, just Laszlo, are we okay to just...
Yes, yes, thank you, Mandy. If you could just move to the next slide. And
okay, I've got a little bit stuck here. Just bear with me 1 second. There we go. So have a look, go to our wallclap.com and enter the event code in the top, so the event code YYZGSN, and then, or you can do the QR code so that we can rate our organisation.
Just to add to that, Mandy, I've also added the direct link to the chat.
Great.
That's a lot quicker.
Okay, so, and so Laszlo, will you put the results in the chat there?
So I'll do a screenshot and share it in the chat so everyone can see the results. So maybe give another minute to everyone to participate. See the responses coming in, and the responses are anonymized, by the way. I'll let you know when the number stops.
Those of you who, I wouldn't encourage multitasking, but Laszlo has put the link to the framework in the top of the chat. So if you want to have a look at that, that's there.
Right.
Okay, shall we have a look?
Let me see. Think. Give it maybe 10 seconds for everyone to complete their votes. Right, so yeah, that's pretty good. That's 51 responses, and interesting results. I'm going to share it in a second.
I'm not even sure I could guess, to be honest, what it looks like, but let's try.
It's not what I was expecting.
Oh. Can you type it in?
Right, so I've got the results. I'm just sending them now.
Okay.
Right, looks like I'm unable to.
Okay, just give us some percentages then, if you can.
Share images directly. So 26%, that's 14 people, said that their mental health support is currently at a basic level.
Yeah.
The majority, 42%, 22 people said it's emerging. 28%, 15 people said it's mature. And only 4%, that's 2 people, said that their maturity level is advanced.
Wow. So the most is for mature then. It's what we're describing, although we've got 26% at basic. Is that right, Laszlo? That's
right. And yeah, 42% emerging.
42% emerging. Well, this is great. I'm very excited about this, actually. I think, I mean, to be fair, I would have expected this. And I'll tell you why, because in a way, with emerging, what we've got is, I hope, I'm going to in a minute show you some policies. I'm going to show you some skills and resources. So I would hope that for those people who've got the emerging, if you have a look at the framework, I can be optimistic that you can get to mature if you put some of those policies and practices in place from our framework. So let's have a positive hopefulness about that. All right. Laszlo, anything else from you? Shall we move on?
You can move on, please. I'll just share the screenshot in a second.
Okay, great.
Thank you, everyone, for that.
Yeah, great. So what we've just described, we've done understanding a bit of mental health, we've done continuum, we've done healthy habits, we've looked at the maturity of the organization. So now let's look at how we define what your framework will look like. So don't forget we've got the pillars, but within those pillars, it's going to be specific for your organization. So if we think about defining your mental health framework, we need to start with a leadership commitment and a voice. We need to start with what does your leadership think that good mental health looks like? What does your leadership, where does your leadership want the vision to be? And don't forget, for me, a vision is about that. You never get to the vision, but the vision provides the pathway. And if you don't have the vision, everyone goes off in different directions. So we definitely need a vision, a commitment, and a voice that helps that. And I suppose, I remember going to a presentation to a conference where Prince William was there. He was talking about the vision of, they did Shout, which is the text talk. His vision. I mean, he's already done so much work with regards to good mental health, and it feels like there is a vision that he's holding, like there is a pathway. And I guess what I'd like you to really think about is what are some really good examples of that. And on the orange box in the middle there, I've got Unilever's vision. Our mission to employ health and well-being is to add healthy years to the lives of our people, unlocking untapped human potential for our business and our work. I like this one because it says, that we want people to come and work here, but also because they work here, their longevity is increased, their healthy longevity is increased. How incredible is that? And I do feel that you can be ambitious with your vision, that you want people to come, and the last thing you want is that people to come and work for you and have their sleep and their health and their weight and their anxieties and their worries made worse because they come and work for your organization. We want a vision that says we add value to people's mental health within our organization. And there's some lovely ways to really think about that and use the examples that we've got in the framework. We've got lots of other examples of the visions of various organizations. We also have to think, don't forget, look, you're defining what your vision, in a way, what your framework will look like. And you therefore have to look at the consideration specifically of the employees that you have. Do you work in organizations where you've got a high proportion of neurodiverse employees, where our mental health activities and events need to be targeted specifically? Don't make them too general. We need to look at people. Do you have life stages of slightly a workforce that's over 50? You have a lot of, because actually there's a huge amounts of really valuable mental health activities and events that can support people in the tertiary stage of their life, or Gen Z, like younger people. I do quite a lot of work on the mental health of under 30s, and to really be able to have target specific activities for those people at that life stage. Gender, home, hybrid working. Have you got have you got people doing hybrid working, or is it mostly like out on site? Maybe there's loneliness, maybe there's isolation. What are you doing for people who have to drive a long way, travel a long way, start really early in the morning, do shift work, high stress roles? And in our framework, we've got quite a lot of detail about how to think about employees where there are some specific consideration. You want your framework to be inclusive. You want it to be general enough to be applied across the board, but you want it specific enough to feel that it's inclusive for the different groups of people that you have within your organization. Also, when we think about a framework, defining it, do we need new policies? Don't make new policies up just, because for the sake of it. Can you amend and your existing policies, or do we need to have new policies? And one of the things that I'm going to show you in a second is we spent quite a bit of time in the framework. In fact, I'm just going to see if I can do that. Let me just do that. Yeah, we spent quite a bit of time in the framework actually looking at some specific policies and how you can add mental health to those policies. But also we've got an example here of a dedicated mental health policy. What does a dedicated mental health policy look like, and how so that you don't have to do all the work, really. We've helped you not have to reinvent the wheel. You can use our bullet points to help us do that. And also in the framework, you'll see these little tables at the end of each section, which has got other resources, other nice sort of like really good, quite general resources that can really support you with that. So just to go back to that sort of define for a second on let me just go back to that. There we go. So we need to think of we need the leadership vision, the leadership commitment. We need some specific considerations for who the people are within your organization. We need to look at the policies. Do you need to have new policies for mental health, or can you add and contribute to existing ones? And then what does success look like for you, and measuring outcomes? So maybe people on our call who are all about the evidence, like, does it work? Does it make a difference? Now, I'm a really incredible believer in, let's have a look at how it does make a difference. How are people's lives and feelings and thoughts and behaviors and sickness improved by our mental health framework and our mental health policies and our mental health action? But remember also, certain things can't be measured. Like I can't measure how much I'm passionate about my work. I can't measure how much I love going for a walk halfway through the day. I can't give you a figure out of that. So not everything that is really, really important to be done can be measured. Just remember that. That's quite important. However, I know about success and outcomes are really, really important for us. Okay, so defining this is something you need to really look at your organization, because although we have the framework, which is our pillars, each organization's framework will look slightly different. The muscles and the sort of like the beef around it will look slightly different according to whether you are a hybrid, a technology environment, to an on-site environment, to a hospital or a nursing organization, to a solar panel organization. That we have the framework in place, but all of the details will be different according to what the people there, their desires, their interests, their wants, their expectations. All right, so we understand what mental health is, we understand our healthy habits, we're defining what's right for the people that we have. What about deploying it? Deploying meaning putting it into action. Well, what does that mean for us? Well, putting things into action. That mental health awareness should be integrated at key touch tones of the employee life cycle, from induction to retirement. So when people start, they should be able to understand what the vision is, what their resources are, what they can expect for good, proactive mental health, and when they're struggling, but also towards in their management discussions, what they can expect, what the activities and events, and then maybe towards the tertiary part of their career, what they can expect. So it's all the way on the employee life cycle. So I've got a couple of bullet points here that we describe in the framework about deploying it. Now, we do need to think about who's going to drive this. Is this going to be a director? Is this going to be a team? Is this going to be part of someone else's job? Is this going to be a sole responsibility for one of your managers, for one of your leaders? We talk a lot about the pros and cons of that. We talk a lot about the importance of having it at a leadership level there. But we also talk about, we're going to come to when we talk about embedding as well, you won't be able to embed a mental health framework or embed mental health unless it's systemized through the organization. Part of training program, learning and development, stress, health and safety. So we want leader and manager training that's appropriate and relevant for what their role is. It's essential that we do that. And actually in the framework, we provide a line manager training, a sort of a sample agenda for what that looks like. We also look at the pros and cons and the evidence and importance of mental health first aiders. Are you going to have mental health first aiders? Are they relevant in your organization? What's their role? How are you going to support them? What does their curriculum look like for support? One of the things I spend quite a lot of time doing is providing a sort of curriculum of ongoing learning for mental health first aiders. But you may not want that. You may want champions who have a slightly different role. Make sure you're clear about the role of those and you're not expecting people who have a really brilliant interest and some life experience to become experts in this. It's really important that their role is appropriate to their own level of commitment and ability and qualifications. I would also, in terms of deploying, many of us now, as I've said, involve EAP, involve local charities, involve local resources, involve national resources. How do you educate your workforce about that? Where's the information? Where's the links? Where's the posters? Where's the communication? How often is communication about your employee assistance program, for example? Is that across all of our mental health awareness? Is it across all of your other health and safety training? Is it something that your leaders and your managers can role model talking about? There's no point having an expensive resource that's then not used. Technology is incredibly important within this area. So we obviously have that sort of that sense of thinking about the digital platforms, that are apps which are brilliant, but also not expecting people to get all of their mental health information from the screen. Part of good mental health that you saw in my healthy habits is to come away from screens, is to connect individually and humanly with people, not do all your connections on screens. As I've said before, the screens we look like we've got 500 links, so we look like we've got thousands of friends, but we're more digitally connected and we're less psychologically connected. So don't think, please, that digital platform and apps are going to solve the whole problem. They're an integrated part of this. They're brilliant for access. They're brilliant for updating. They're really brilliant for starting the discussion, but they're not the whole activity, and that's really important. So when we think about deploying and we think about putting things into practice, you know, we've got another little sort of mini framework within our framework, which is all about communication. You know, when we've got, you know, that basic level of maturity, we may have our employees who are aware there's some exposure, they're aware of it. But as we move through that maturity, like maturity matrix, we want our employees to sort of understand why we're doing it, understand how this is important, but believe that what role they play in it, believe their own participation, believe that it is important for them to take responsibility both for themselves, for others, for their organization. And then advocacy, you know, allies. So things like, you know, we think about mental health allies, we think about male allies, we think about all sorts of allyship for people within our organization, which is so, I come from a background of social work and community work and youth work, where it's so much about advocacy and allyship. And that's been a theme for me throughout my whole of my career. So for me, that's such a huge part of mental health awareness and getting to maturity. So thinking further a little about deploy, the other thing that I just want to mention now is that we've talked a lot about your organization, what you're going to be doing in terms of like those frameworks, but part of deploying our mental health framework is providing resources for people who are struggling. So in that framework that we talked about at the beginning, in the continuum, what about those people who do actually need some intervention, who have anxiety, who have depression? We have in our workforce maybe sort of so many, 50, 60% of people who feel stressed, but we also have in our society about a third of the people in our society who are experiencing anxiety or depression of some sort. So how can we expect our organizations to support those people who are struggling with mental health issues? Well, we have got in the framework a little plan here about early intervention for colleagues who require support for stress, returning to work after illness, who require a sort of intervention, but not necessarily a professional intervention, but they require an intervention that's going to help them feel that they belong, help them feel that their workplace cares, help them feel that their isolation or their loneliness or their illness is actually supported positively in the workforce. And we call this sort of an early intervention. And in the framework, we talk about in quite a bit of detail how to manage that. Mental health first aiders, buddies, mentors, all sorts of ways to help people who are struggling. But then there are people also who require treatment. If you've been diagnosed with an anxiety disorder, if you've been diagnosed with depression, and by the way, both anxiety and depression have increased since the pandemic. We haven't, so during the pandemic, the levels went up, but we haven't gone back to the base level it was before, which is very worrying. So we have a lot of people who are experiencing some symptoms and some concerns that really can debilitate them from performing well in a way that they'd like to perform in the workplace. So for colleagues who require treatment and therapeutic programs, the workplace can be a great resource for that. It can be a great professional resource. We can refer to our EAPs, occupational health, for reports to help us look at reasonable adjustments. We can help to find the right resources for the right people in a good timely manner. And that's one of the great things that workplaces have the resources to be able to do. And then, of course, once we have supported people, through early intervention, maybe some active intervention, we want to maintain their well-being. They want to come back to work, and we want to reduce the risk of relapse. For any of us who've been off with mental health issues, sometimes we come back too soon, sometimes we come back without adequate support. And the risk of relapse, if we do relapse, it then actually really knocks our confidence to come back again. So just understanding some of this is an essential part of the framework. And again, remember what I said before, in the framework, what we do is that we add some sort of like really good general resources to help you look at how you can do promotion and prevention using Samaritan material, using mind material, what early intervention might look like with your EAP, referring to the British Association for Counselling and Psychotherapy, have a whole really great sort of catalogue of counsellors and psychotherapists, and also information about how to choose the right person for you. But then also active intervention, so those professionals who are in the area, and then maintaining it. That we're going to talk about that in a second when we look at embedding the framework within the organisation. So what I'd like us to do, actually moving through to the embedding our framework, is ensuring continuous improvement by building nice, stronger resilience and driving cultural and behaviour change. So just because I want to leave a little bit of time for questions, I'd like to just look at what does that look like. And I guess we'd love to get to the point where we have, I mean, some organizations may have mandatory training or voluntary training, but I think if you're going to embed a framework and really have a vision that is serious, we should have some mandatory training for our leaders and our managers in mental health. We can also do, not just put in webinars on, say, I don't know, say sleep or on anxiety, but maybe do incremental awareness sessions. I was just going to show you that I worked with an organization where we had, for 1 month sleep awareness month, we did 3 webinars, one just on general healthy sleep ideas, one on the things that like get impacted when you don't sleep, and the other one on like then ideas for good sleep. And we got everyone to sort of, those people who had their watches, to bring their their little sleep pictures so that we could put those on and we could analyze it and we could understand all the things about sleep stages. So we sort of like really got to understand that sort of sense of some aspects of good mental health. It can be, we could do that for anxiety. We could do that for neurodiversity and the impact of mental health issues on neurodiversity. We could do that for parents. We could do that for menopause. We can do that for suicide awareness. So don't just do like just one thing on one topic and 1.5 hour and think we've done it, tick box. Really have a think about incremental and adding. Okay, technology, we've talked about that before, but how can you develop that technology to fit what you are doing within the whole framework? Reporting back, thinking about reporting and cascading information up and down, timely messages. So report up and then cascade information back down. So it's an up and down movement. And then maybe even high profile activities that really keep raising it. So charity sponsorship, targeted campaigns, marathon, did people within your organization just run the marathon on Sunday for certain things that they're interested in? How much is that talked about? But those of us who, do other activities, how much is that talked about? Do we have like a newsletter? Do we have a voice? So how are we talking about this and having an ethos that really like embeds mental health messages? And then moving towards standards. I work with BSI, British Standards Institute, and we are producing a standard on suicide awareness in organisation that's going to be out in September, October. Working toward, they've got a standard on menopause. We've got BITC, business in the community. We've got guidelines on what good mental health in the workplace looks like. What about working towards those standards to really embed it? And then slightly more political with a small p, but challenging business as usual processes to include knowledge of good mental health. And what I mean by that is look at the procurement. Does your procurement team make decisions with suppliers who actually have good mental health in their organizations? Do you, when you hire, if you're asking people to travel and start working at sort of 7 a.m. on site, how are you providing people with healthy nutritional breakfasts? How are you providing, helping people around sleep? How are you? So I want us to think carefully about making decisions, financial decisions, where we understand that mental health is really important, not just for our employees, but our contractors and our procurement decisions. That's quite an important and sort of key one for the supply chain that we have. So I would really implore you to think about that as you embed these practices. All right, so just to sort of finish on that, remember that in the framework also, we've actually got some examples in the little corner there on the right-hand side there, how to sustain the conversation. And we've got examples of organizations who continually, so those people actually, the advanced people, we've got 4% on our list of people who have the advanced level of maturity. So an interesting question would be how you embed and sustain the message. And so please feel free to put up in the chat for us how you embed and sustain the messages and communications around mental health. Okay, I hope that's been helpful. I'm going to stop there and let's have some questions if we have them. Laszlo, shall we? Shall we take?
Right, so we've got 4 questions. Starting with Naj, who is asking where would you position burnout in the mental band? So I think
Yes.
Naj is referring to slide 11, the mental health continue.
Yes, great. Let me just put the slideshow back up. So let me just put that back up and get rid of that. Yeah, so great question. So don't forget, I would, I don't know if you can see that now, sorry, it's there. So where would I would put burnout, to be honest, I would put burnout in struggling. But don't forget stress. So burnout doesn't just happen all at once, but there are various stages to burnout. Burnout is, from the World Health Organization, burnout is chronic stress which has not been effectively managed. So chronic stress which has not been effectively managed. So if you think about that, we get stress feeling like where we feel that we've got too many demands placed upon us that we're unable to manage. So you can feel stressed when you're in managing, and you can do something about that and to get back to flourishing. You can feel more stressed when you're in coping. You think, right, I'm feeling stressed, but I'm going to do something about it. But if you feel stressed in coping and do nothing about it, you'll go into struggling, and I would put burnout in struggling. Hopefully that's helpful.
Thank you. So the next one is just about the presentation, whether we can share it with delegates. We don't normally do, but unless you have any objections, Mandy.
No, I'm really happy to do that. Please bear in mind that it's relevant for today and it isn't relevant for all organisations at all time, but please, yes, use it appropriately.
Right, next one. How do you recruit mental first aiders? Good question.
Really good question. So first of all, can I go back a step? I really would like you to think about whether mental health first aiders are right for your organisation. Now, let me just go back where we were, mental health first aiders. I think maybe we're here. We think about mental health first aiders. I would like you to think about whether they are relevant for your organisation first. Mental Health First Aid England have some really great resources for mental health first aiders, but how you recruit them is that you would need to do campaigns around who is interested in this work, who is interested in spending time, devoting some of their time to mental health awareness in the workplace. So you've got time issues, you've got awareness issues, you've got, are they going to be able to be released from their work to do the training? And then there's no point giving people the training when they're so busy that they can't then have time to be aware to support people. But if they're going to support people, are you going to involve their line managers in that? Do we have, what does our leadership say about giving people time to be mental health first aiders? Have you got resources and money to pay for them to be trained? And then how are you going to sustain their skills, if you like, and their abilities? So, and are they going to be mental health first aiders? Mental health first aiders, are you going to have a rolling program? Are you going to recruit, maybe have 5 and then recruit 5 in 6 months' time and then 5 in another 6 months' time? Because you can bet your bottom dollar that if you recruit 5 now, something will have happened to them over the last 2 years and over the next year, and then maybe you'll have just 3 or 2 left, and have you got enough resources to recruit some more? So it's not just recruiting people who are interested. There's a lot more organisational things to be thoughtful about. So I would discuss that with Mental Health First Aid England, who are the main people, or I'm happy to talk about that with you, sort of like in relation to, is it relevant within your organisation? Or maybe champions are a bit more different, whereby in each directorate or in each division, maybe we have 2 or 3 champions whose role is to just raise the profile of mental health.
Right, thank you. So maybe it's time for one more. How do you identify and support someone that may be in the red zone, and what are the trigger signs?
Right. So we so is the question, how do we support people? Did you say, is it
someone who is in the red zone
yeah.
on the
So
continent?
so first of all, you need to have a conversation, and I am we run training courses on this, so we can do this, but just in 30 seconds, please use the positives of your relationship with that person. So you can say to that person in a very kind way, in a nice sort of like comfortable sort of environment. I've noticed you're not quite yourself at the moment. I've noticed that it feels like you're a lively person and I've noticed that you're a bit quiet. Shall we talk about that? I've noticed that things aren't quite going quite well. Shall we have a chat? So that you can engage in a good conversation, start the conversation, listen. And what you'll notice is that I could give you a list of symptoms, which is as long as like my two arms, if you like, from everything from people being manic and cross and angry and having aggressive tendencies and being irritable, all the way through to people withdrawing, people being quiet, people having even doing self-harm, people suicide attempts. I could give you a whole lots of symptoms, but the thing is that the people in the red are not their normal selves. And that's really important, that when I'm in the red, I'll have some different signs and symptoms to when Laszlo's in the red to when you're in the red. And therefore we need to get to know people when they're well so that we can understand and notice when they're not so well. So start the conversation, be specific. And then if you haven't got employee assistance program in your organization, EAP is the first. Make sure everyone on this call knows your EAP. Give it a test call. I used to work at an EAP. I used to love being the call being tested. It was great to have conversations. Test the EAP, phone it today, check what it does, how it works, all of the helplines. Don't refer anyone to a helpline that you've not tested yourself before. Use those we have fantastic resources, whether it's Mind, whether it's Samaritans, whether it's the text, whether it's specific Rethink, mental health, first aid. There's loads of really good resources which we've actually got in the framework as well. But please don't leave it. Please don't think, oh, they'll probably be okay. Have a go. Better that people say, no, I'm fine, than actually you haven't asked. And then ask again. All right, Laszlo, I think we might be out of time. Do you think? Oh, can you hear me? Hi. Hello.
Right. Are you there, Mandy?
Oh, yes, I just lost you for a second then. I just lost you, didn't I? Can you hear
Right.
me?
Yes. So if you could move to the last two slides,
Yes.
just to.
There we
So
go.
really, it's just a reminder before we finish our session. Just a reminder, you can download the free copy of the mental health framework, and my colleague has also put a direct link in the chat to the framework. Just bear in mind that you will need an account, an EI account for this, but you can create one in a matter of seconds on the main website. So you don't have to be a member, you just need a free account in order to access the mental health framework and other materials. And finally, I would like to thank Mandy and my colleague, Amy, who's been working in the background, running things smoothly. So thank you, Mandy, for a very insightful.
You're really welcome. It's been great, and I really hope it's useful for everyone. And please let us know your comments. If you use it, please let us know. If you use the framework, please let us know your comments. We'd be really, really good, because we're going to update it hopefully each year.
And I've left my email and your email there on the last slide, Mandy. And I'm sorry we didn't have time for more questions, but if you have any further questions, any feedback on the framework or this webinar, have any questions about the EI, please feel free to drop me an email, and I will go back to Quasim on that last question we didn't have time for.
Great.
So thank you, everyone.